Hi, I am Cindy from the WVU Medicine Center for Joint Replacement, here to tell you what to expect for your post-operative care. When you arrive on the orthopedic floor, you will be assisted in getting out of bed and begin walking with your walker. We encourage your coach to be present as much as possible. You'll begin ankle pump exercises and continue them through your hospital stay in order to prevent blood clots from forming in your legs. Blood will be drawn and you will bathe and be helped out of bed every morning. You'll wear loose-fitting clothing you've brought from home. Shorts and tops work best. Be mentally prepared to work by participating in physical therapy and doing things such as getting out of bed for your meals. You should be up in the recliner during the day and try to maintain your normal sleep-wake routine. Your surgeon or one of the residents will visit you in the morning. Once discharged to home, you'll need to control your discomfort. Take your pain medicine at least 30 minutes before your physical therapy, gradually weaning yourself from prescription medication to Tylenol. Change your position frequently throughout the day. Apply ice to your affected joint to decrease pain. Do not use ice for more than 20 minutes each hour, and ice before and after your exercise program. You may have a poor appetite, but your desire for solid food will slowly return. Drink plenty of fluids to keep from getting dehydrated. You may have trouble sleeping. This is normal, but don't sleep or nap too much during the day. Try to maintain your normal sleep routine as much as possible. It's normal for your energy level to be decreased initially. Your prescription pain medication may cause constipation, so use stool softeners or laxatives such as milk of magnesia or magnesium citrate if necessary. If you have questions, please contact your orthopedic nurse clinician.